Hey guys, I hope you're all good. So today we'll do a video on the pharynx and the larynx. So we'll start with the pharynx, then get to the larynx at the end of it. So the pharynx is divided into three parts: a nasopharynx, an oropharynx, then um, the laryngopharynx. So the nasopharynx has a posterior border that is the arc of the atlas, that's C1. Then the posterior border of the oropharynx is C2, C3, and part of C3. Then the posterior border of the laryngopharynx then extend down to get to C6. So the superior border of the pharynx, which also is the superior border of the nasopharynx, will be formed by part of the greater wing of the sphenoid, then the part of the occipital bone that is anterior to the pharyngeal tubercle. Then anteriorly, you have those posterior nasal apertures separating your nasopharynx from the nasal cavity. And remember, the nasopharynx will also have respiratory epithelium that is pseudostratified ciliate columnar epithelium that is just the same as the one that is coming from the nose. And then on the lateral wall, you find that major pterygoid plate. The lateral wall now of the oropharynx will have the pterygomandibular artery, the hyoid bone, the stellohyoid ligament, and the fourth part will be the tongue. So it's the tongue, the hyoid bone, the ramus of the mandible, and as well as the stellohyoid ligament. Then the anterior wall, you now have the oropharyngeal isthmus separating the oral cavity from the oropharynx. Then the roof, which also is the floor of the nasopharynx, will be formed by the soft palate as well as the pharyngeal isthmus. Then in terms of innervation, the nasopharynx is innervated by the maxillary division of the trigeminal nerve, that's V2. Then the oropharynx will be innervated by the glossopharyngeal. Then the laryngopharynx will be innervated by the internal laryngeal nerve that we'll also talk about when we talk about the larynx. And then the larynx, we've already talked about the laryngeal inlet having the epiglottis anteriorly. Then posteriorly you find the aryepiglottic folds. Then lateral to this, in the lateral wall, you find the piriform the piriform fossa that will then have those thyrohyoid membrane forming the medial wall, then the quadrangular membrane forming the lateral wall together with those epiglottic folds. And then so you may have lodging of fish bones in that area, which will actually impair proper function of the laryngeal vessels that will actually cause beneath that. So in terms of nerve supply, we've talked about the maxillary, the glossopharyngeal, then the internal laryngeal. In terms of blood vessel, you have an ascending pharyngeal artery that is from the external carotid. You have a lingual artery from the external carotid. Then you have a facial artery that gives rise to an ascending palatine, as well as the tonsillar artery that pierces the superior constrictor. That is one of the constrictor muscles of the pharynx in that tonsillar bud, which will also give branches to the pharynx. And then in terms of venous drainage, most of the venous drainage will go to the pharyngeal plexus of veins, as well as some going to the pterygoid plexus of veins that will communicate, of course, with cavernous sinus, but that's something else. Then in terms of now talking about the muscles, we have two pairs of muscles. We have the constrictor muscles that are staked like cups, that is the inferior constrictor being the outer one. So you have a superior constrictor that arises from that pharyngeal tubercle. You have from the mylohyoid line, the pterygoid hamulus, and the pterygomandibular affair. And then the medial constrictor arises from the stellohyoid ligament, the lesser conure of the hyoid bone, as well as the upper part of the body of the hyoid bone. Then the inferior constrictor will have a thyropharyngeus and a cricopharyngeus part. The cricopharyngeus part will of course arise from the cricoid cartilage. Then the thyropharyngeus part, you find an oblique line on the posterior lamina of the thyroid cartilage that we'll also talk about when we talk about the larynx. So this oblique line on the upper part, you find origin of a thyrohyoid muscle. Then the one that is between the two, of course we have three insertions on that part, right? So the one that is in between is the insertion of a sternothyroid. Then the one that is more below, that is the origin of the thyropharyngeus muscle, and then they all go and insert into the median affair. So the space between the superior constrictor, the convex part of the superior constrictor muscle, and the cranial cavity is the sinus of Pogani, which allow for four structures to pass through. That is the auditory tube, the ascending palatine artery, a palatine branch of the ascending pharyngeal artery that came from the external carotid. As well as so I've talked about those two arteries, then the auditory tube, yeah. Then the space between the superior constrictor and the mid constrictor will have the glossopharyngeal nerve and the stylopharyngeus muscle. Then the space between the middle constrictor now and the inferior constrictor will have the superior laryngeal artery and the internal laryngeal nerve. Then between the inferior constrictor and the esophagus, that's where you now find the, what do you call it, the recurrent laryngeal and the inferior laryngeal vessels. So the narrowest part of the gut, removing the appendix, is the part where the crick of the pharynx joins the esophagus. That's at C6. Of course, removing the appendix. Then the other muscles now, you have a stellopharyngeus, a palatopharyngeus, and a salpingopharyngeus. The salpingopharyngeus will arise from the lateral surface of the auditory tube. The palatopharyngeus will arise from the palatine aponeurosis. Then the stellopharyngeus will arise from the medial surface of the stellate process. Remember, the stellohyoid muscle will arise from the posterior surface. Then from the anterior surface, you have a stelloclosus muscle. That is the muscle of the tongue supplied by the apoglossal, and then the stellohyoid muscle is supplied by from the facial nerve. So all the muscles that arise from the stellate process will actually have different innervation. So you may have Eagles syndrome, that is where you have inflammation of that stellate process. So you may have a problem with these muscles, as well as a problem in the carotid system of vessels. Why? Because the stellate process will project between the origin of, or rather the bifurcation of the carotids into an external and an internal. But if you want more of that, I have a video that I did on the carotid system of vessels. Then on the tip, that's where you find the stylohyoid ligament and the stylomandibular ligaments. Those are the muscles, those are the ligaments. The stylohyoid and the stylomandibular will separate the parotid and the submandibular glands. Then so those are the muscles. They're all supplied by the pharyngeal plexus of nerves, except the stylopharyngeus, which is supplied by the glossopharyngeal, which it actually moves in company with. And then so this pharyngeal plexus gets its motor root from the accessory nerve. And then it also has a part that is arising from the superior cerebral ganglion that gives sympathetic innervation. Then it also has the pharyngeal branch of the glossopharyngeal that gives cutaneous, rather sensory innervation. So that's basically the pharynx in a nutshell. And then looking at the space between the thyropharyngeus and the cricopharyngeus, that's the pharyngeal pouch, which is the Killian's dehiscence, where you have you may have outpouching of the mucous membrane into that space. That becomes a weak area. Then in terms of the layers of the pharynx, now you have a mucous layer of the pharyngeal wall, right? You have the epithelial layer, and then beneath this epithelial layer, that's where you find the Wardia's ring of lymphoid tissue. That's a pharyngeal lingual. Then more laterally, you have two of them now, the palatine and the tubal. Then so that's the epithelial lining. Then you have the pharyngobacillar fascia lining the inner side of those muscles, and then you have the muscular part. Then you have the buccopharyngeal fascia, which is rather inconspicuous. Then it also covers the baxillary muscle. That's the name buccopharyngeal. And then these two actually communicate and join each other at the level of in that sinus of Morgani, rather at the upper border of the superior constrictor. So we'll now get to the larynx. The larynx now it's rather cartilaginous, and it has 3 paired and 3 unpaired cartilages. So you find that the 3 unpaired, you have the cricoid, the thyroid, and the epiglottic. Then the paired one, you have the epiglottic, corniculate, and the cuneiform one. Those are also known as Santorini and Risa and whatever. Then 3 of them are hyaline in nature. Then 3 of them are epiglottic in nature. E for epi. So rather elastic in nature. Sorry, not epiglottic. Then E for the epiglottis is elastic in nature, together with the corniculate and the cuneiform. Then the lower part of the so the epiglottic cartilage as an upper part, that is rather elastic, and the lower part that is rather hyaline, but it's just generally considered as hyaline. Then you also have the cricoid and the thyroid being hyaline. So the cricoid is one that is signet ring in shape and has a narrow anterior wall and a broader posterior wall. Gives origin to the cricopharyngeus muscle. Then talking about the thyroid, that is rather more important. It forms the prominence of the atoms. Therefore, rather I do have a larger prominent one. So it's 90 degrees in males, than 120, rather 90 degrees in females. In males, rather, that is more acute. Than in females, it's more obtuse. That is around 120 degrees. So you'd find that also that's the relation that you have with the subpubic angle, where you have females having a larger subpubic angle that is 80 to 85 degrees, then the males just have a 50 to 55 degrees, if I'm not mistaken on that one. Then the thyroid cartilage has an oblique line on the posterior lamina that gives, we talked about it earlier, that has a thyroid muscle, sternothyroid, then the thyropharyngeus, then it is the posterior lamina that gives incision to those three pharyngeal muscles, that is the stylopharyngeus, the palatopharyngeus, and the salpingopharyngeus. Then it is posteriorly in the midline, gives actually a thyroepiglottic fold, and then also gives incision to the vocal fold as well as the vestibular fold. So the cricoid cartilage will articulate with the thyroid cartilage, and will also articulate with the epiglottic cartilage, and both of these joints will be synovial joints. Then the epiglottic fold will also articulate with the coniculate, and that joint is also synovial in nature. So the epiglottic fold and cartilage and the coniculate and the cuneiform will actually lie in the posterior on the posterior aspect of the epiglottic membrane. So those are basically the cartilages. Then in terms of muscles, now you have extrinsic and intrinsic muscles. The extrinsic muscles, you have those three pharyngeal muscles: the salpingopharyngeus, the palatopharyngeus, and the stylopharyngeus. Then you have the steno, rather the thyroid, those elevate the larynx. Then the stenothyroid will then depress the larynx. Then the intrinsic muscles, now only the cricothyroid will lie outside the cavity. So this cricothyroid muscle is the one that is supplied by the external laryngeal nerve. Then all the other muscles are supplied by the recurrent laryngeal nerve. That is rather a branch of the vagus nerve. So on the left side, it hooks on the arc of the aorta. That is a remnant of the distal portion of the ductus arteriosus. Then on the right side, due to the fact that the distal portion of the sixth the distal portion of the sixth aortic arc degenerates, so it will come to lie on the fourth arc that gives rise to the subclavian. So you'd find it on the hooking on the subclavian artery, rather than on that ductus arteriosus, on the arc of the aorta for the left one. So the recurrent laryngeal will supply those muscles. So the cricothyroid tenses, then the thyroarytenoid relaxes. So another mnemonic is NOWT, NOWTE. What narrows? N for narrow is the oblique thyroepiglottic. Then NOWT, right? W. What widens, right? What widens? So what widens, right? It's NOWT. So what widens is the thyroepiglottic. What narrows is the O, is the oblique, right? Then in terms of now the other muscles, so all these muscles, they adduct. So the only safety muscle that abducts is the posterior what? As the posterior arytenoid muscle. So the lateral one abducts. And then what tenses the larynx? So the cricothyroid tenses, right? We talked about that. Then the posterior arytenoid abducts, is the only safety muscle. Then the lateral one abducts. and then all the other ones they also abduct, despite the fact that the oblique arytenoid it actually um, narrows the cavity. Then the theroepigloticus widens the cavity. Then, so in terms of innervation, all of them are supplied by the recurrent laryngeal nerve, as I said, and except the cricothyroid. So you find that now when you have injury to the recurrent laryngeal, which is partial injury, you affect mostly the abductor muscles. Why? Because their fibers they actually cause more superficial, and then they also get the most fibers. So your larynx will assume a rather it will assume a rather it will assume a rather abducted position. So you may have troubles in breathing. And then the laryngeal cavity, of course, is divided into a vestibular part, then a sinus part. That's the glottic part. Then you have an infraglottic part. And then that's vestibular part is the supraglottic part. So that's just about it for the cavity. Then what else would I have left out on the larynx? So the space between the vocal folds is the rima glottis. Then that space the the vestibular folds is the rima vestibuli. So the rima glottis is the narrowest part. So I'd find that the anterior 3/5 is is rather membranous than the posterior 2/5 is cartilaginous, formed by the laterally by the vocal processes of the arytenoid cartilages. Then anteriorly you find the vocalis muscle. That's why it becomes intramembranous. So this remark glottis is the one that actually moves during phonation and speech or whatsoever. So under normal breathing, the anterior part is triangular, then the posterior 2/5 will be rectangular. So this actually changes shape depending on how you pronounce words and how you want sound to come out. Like example, when you whistle, it actually has to form a diamond shape. So that's just about it for the region of the pharynx and larynx. This is just a nutshell and overview, but then there is more to it. Have a blessed time and a blessed